Hi guys, I really miss y'all. Today I will be talking about T-cell acute lymphoblastic leukemia. I am going to try to talk fast. This disease have so much information. It was so complex. So I am going to try to squeeze the most important information into the minutes that I have. Okay, so this is a very rare form of leukemia, and my cousin Mina was actually diagnosed when she was 19 months old. Um, so this is an abnormal cell that attack the lymphocytes, and instead of the lymphocytes replicating and doing what they're supposed to do, they actually form a leukemic cell that multiplies rapidly and reduces the level of red blood cells and platelets in the blood. The etiology of this is unknown. Some of the signs and symptoms, it occurs mostly in children, boys more than girls, although some adults are affected. You will see nervous system involvement, which is why my cousin seen a decline in Mina's balance. She started having multiple falls. Is one of the reasons that she wanted to have a follow up and see what was wrong. You could also form mass on the lungs. Other symptoms that Mina had experienced was she had low grade fevers. She was very cranky. She had decreased appetite, syncope, anemia. She also had a very enlarged thymus when they did the x rays. Some other complications that Mina faced once the process got started was she had a cath failure. So they did do surgery and place a cath. The cath ended up getting a fungal infection, so they had to treat the infection, do surgery, remove the cath, and also place a new cath. All of this is going on while she is less than 2 years old. She also developed a fungal infection of her spleen. She had altered mental status, mucositis, all kind of other symptoms that went on, as well as the leukemia. When Mina was first diagnosed, she was misdiagnosed and to have a sinus infection. Once the course of the sinus infection was due to be complete, there were so many physical symptoms that Mina still was experiencing as to why my cousin Lindsay wanted to take her in for another look, and that included the falls. She had redness around her eyes. She was still very drowsy, didn't want to eat, really cranky. So, when they first went back to the hospital, they did a full blood workup. It included a CBC. And in Mina's instance, her CBC showed that she had 275,000 white blood cells, and the norm is normally 4,300, so 4,300 or to 10,800. She had 275,000. Her hemoglobin was 4.7, and the norm should be greater than or equal to 11. Her platelet count was at 56,000. The norm should be 150,000 to 400,000. So her blood levels were completely off. So that's when they did further testing. They sent her immediately to Children's to start the process of treating her for leukemia. Once she first got there, her tests were retested. She had 92% abnormal blood cells floating around in her blood. So almost all of her blood was abnormal at that point. She had a bone marrow aspiration, a biopsy was performed, and that's when they actually gave her the diagnosis of T-cell acute lymphoblastic leukemia. Now, for the treatment, they immediately gave her plasmapheresis in an attempt to correct the white blood cells, get them at least below 100,000. Over the treatment of chemotherapy, they went with the chemotherapy. This condition does call for cranial radiation. They did not choose that treatment for Mina. Now, during this whole process, my cousin did make emphasis that Mina in all had 151 rounds of chemo treatment over the 2 years and 11 months that she was going through the process. She is now 7 years in remission, so we are feeling great about the situation. I have a lot of pictures that I wanted to show you all from when Mina was first diagnosed. She had a head full of hair, but you could still see the redness and puffiness around her eyes. She looked like she was very aggravated or irritated. She couldn't express those things that much, but you can tell in her demeanor. I also have some pictures from once the chemo treatment started, the steroids that they put her on. She blew up so big and looked like a completely different child. And then I have pictures from now in time. Her hair has grown back. She is lively. She plays baseball, so she's doing good. The prognosis for this is normally the survival rate is at 80%, which, my cousin Mina will be following that good 80% survival rate. She has been in remission since in July of this year. It'll be 7 years full remission. She only goes to the hospital to do blood work, complete physical, and they check all aspects of her health, but that is only once a year at this point. Another page that I will be uploading is her medications. Most medications, she do have 11 medications that she was on at some point in time throughout the process, but I made note to those that most of them are chemo treatment, others are steroids, but I made note to the ones that my cousin Lindsay told me affected her the worst. The methotrexate, and it's an immunosuppressant. It caused her to have the hair loss, the severe stomach pains, headache, nausea, vomiting, and also the dexamethasone, which is a steroid, and that had great side effects. She had trouble sleeping. She had skin rash, which caused bruising, blistering, discoloration around the rim of her mouth. She had nausea and vomiting with that, and diarrhea. So during these treatments, physically, she was drained. And my cousin did make emphasis that once they came home, the key avoiding factor would be the public, because her immune system was actually depleted at that point. That's about all I have for you all today. So I can't wait to see you all. Hopefully y'all enjoy. I tried to sum up the information as best I can, but like I said, this treatment and this diagnosis is very complex. When I did the video for my cousin, she talked for 2 hours before we started the video. So I hope y'all understand it. If you have any questions, let me know. Thank you.